About 55 million children in the U.S. will head back to school in the next few weeks. And that has officials concerned the H1N1 flu will spread further than it already has. The CDC reports more than 2 million people in America have already contracted the virus, killing nearly 500. And now some of the vaccine might not be available when the flu season starts. CBS News correspondent John Blackstone has more.
10 days ago, rural Yolo County, 80 miles from San Francisco, had its first H1N1 death. Stacy Spiegel Hernandez, a young mother.
This isn't supposed to happen to somebody who's 30 years old.
Tammy Brooks saw her daughter go from vibrant to struggling for life in days.
I knew it. I knew it. I knew that my daughter that she was near death.
Stacy's death has shaken this county of 200,000.
So people are calling their doctors now with, "I've got a scratchy throat," afraid that they might be next.
Fear is certain to drive demand for H1N1 vaccine, but the CDC recommends it for 160 million Americans, with priority for pregnant women, children, and healthcare workers. 120 million doses were expected to be available by mid-October. Now, manufacturers say they'll have only 45 million doses by then, adding 20 million doses a week after that. Priority immunizations the government had hoped to complete by early December will now be pushed back to an uncertain date.
We're in a race between the vaccine and the virus, and this gives the virus a little bit more of an advantage.
So, at the start of the flu season, most Americans will have no protection against a virus able to kill the young and the healthy. John Blackstone, CBS News, Yolo County, California.
Joining us now this morning is Bruce Gellin, Executive Director of Health and Human Services Department's National Vaccine Program. Mr. Gellin, thanks for being with us. Good to see you.
Thanks, Jeff. Good morning.
120 million to 45 million seems like a significant reduction. How concerned should people be?
Well, while we had hoped to have 120 million doses if everything went well, as you said, we know that we're going to have at least 45 million doses at the beginning of the immunization program. And it's possible that some of that could even come earlier. But what's really important is to know that once that comes, it keeps coming. We're engaged with 5 different manufacturers, and in total, there are going to be another 20 million doses every week after that.
So you're up to 85 million a couple weeks after. What exactly is the holdup in getting 120 million doses out there?
Well, there are several things that contributed to that. The basic problem is that these vaccines are made with living viruses, and the viruses have to grow in these systems. They're grown in eggs, and every year we have to make sure that the viruses do it the best that they can in growing in eggs. It was initially somewhat disappointing that this virus wasn't growing so well. There have been a number of laboratories around the world, including CDC and FDA and others, who, working with the manufacturers, may be improving that right now, but at least at the beginning, that's what's slowing down the number of doses that can be provided in a certain period of time.
Let's take a look here, if we could, at the priority groups. Folks you think should get this vaccine as soon as they can. Pregnant women, healthcare workers, caregivers of children under 6 months of age, children and young adults 6 months to 24 years, and then adults 25 to 64 with medical conditions. How many of those people who you would like to get this vaccine won't be getting it as soon as you'd like?
Well, it's important, again, to emphasize the reason that these are the people who are being prioritized are these are the people in our spring here, and looking at what's happened in the southern hemisphere, these are the people who are the most vulnerable and who have the complications of the H1N1 virus when they get it. So those are the people that go to the top of the list. The CDC has an advisory committee that looked at these patterns and determined that those are the people that should get it first.
Okay, so in 15 seconds left here, if you're deciding who's going to get it, and are there continued shortages here, how do you decide who does get it?
Well, it's not really a shortage. I think it's really a delay, and I think that the people who are on that list need to anticipate that there's going to be a vaccine available for them, talk to their doctors, talk to their health departments, and start to think about where they're going to get the vaccine when it becomes available.
Okay, Bruce Gellin, Executive Director of the Health and Human Services Department's National Vaccine Program. Appreciate your time this morning.
Thanks a lot, Jeff.